It's been a nice topic. I'm waiting for our viewers to join back in. I can't believe we've actually been on the live video for 1 hour. It's been lovely talking to Sister Corinne. I'm gonna call her back. For those that are just joining in, this is a conclusion. This is the concluding part of the live video we did. We were talking about sickle cell disease and we've been talking for 1 hour. The video just went off. I think you're only allowed to talk for 1 hour. So I'm gonna call her back. I'm waiting for people for our viewers to join back in, and then we can just conclude. Thank you so
That's all
much. I
right.
can't believe we've been on the live video for 1 hour.
Yes, there's a lot to talk about.
Let's just, yes, that's why someone said sickle cell is a long and wide topic that you
Yeah.
can't finish at a go. You keep talking and talking and talking about it because there is a lot to learn about sickle cell, and there is a lot to talk about sickle cell.
Yes,
Let's
yes.
just wait
And the
for.
thing is, there's a lack of knowledge with the condition, which is even in the UK. I mean, GPs lack knowledge, school lack knowledge. It's just ridiculous, really, because it's just such a common condition in the UK and in the US among Afro-Caribbean people. And there should really be more awareness of the condition.
Yes. Any more questions, guys? I've enjoyed myself. I've enjoyed every bit of it.
Yeah,
Thank you
too.
so
It's
much.
something I like talking
Thank
about, so
you.
I don't mind.
It's fine. And Sister Corinne has a Facebook page which is all about sickle cell. It's what's the name of the page, sis?
Sickle cell disease UK.
Okay. Let me type it so that our followers can follow you on the page as well.
Thank
I'm
you.
just gonna type it and then I'll pin it. Is it sickle cell disease? Any space?
No, no space. No space. Let me just.
Okay.
Oh, actually, yes. It's sickle cell disease, as in how you write sickle cell disease with spaces and then UK.
Okay. So if you can please, my followers, my viewers, my family, can you
Mm.
please follow her on Facebook? On our Facebook page, it's called Sickle Cell Disease UK. They do a lot of teaching and awareness on what sickle cell is
Yes.
and what to
Yeah.
look out for, the treatment.
Mm.
If you have anyone that has a child with sickle cell or being an adult themselves that has an adult, a man or a woman that has sickle cell disease, or they've got any questions whatsoever, you can always go onto our Facebook page, chat her up, and she's always ready to answer your questions. You know, you're more than welcome to talk to her about it. So we're just gonna do a little bit of recap, a summary for the benefit of people that are just joining us, because I've noticed that few people are now following, watching now, but they've not actually started with us when we started earlier on. So let's just do a little bit of summary about what sickle cell is, what we've talked about, and then you can call it a day.
Do you want me to summarize?
Yes, please.
Okay. So we know that sickle cell disease is a genetic condition, and we know that you have to have two parents with the genes, and then they pass it on to the child. And we also know that the main symptom there's a few symptoms of sickle cell, but the main symptom is pain, and we call it painful sickle cell crisis. And so in order to prevent having there's other sickle cell crises as well, because you can have a chest crisis. You can have, as I say, you can have pain in any part of your body. But the main the treatment in the UK is based around regular penicillin from the age of 3 months and folic acid. Penicillin to help prevent nasty infection, folic acid to help the red blood cells, help the body make red blood cells in the bone marrow. And there's other treatment or the medicine you can have, like hydroxycarbamide, and that also helps the bone marrow to make new red blood cells. Most children with sickle cell, they live a near normal life, to be honest, until they have a crisis, which is well managed in hospital in the UK. So the care here is excellent, and most people, they live near normal life and life expectancies. Yeah, someone said even the carrier of sickle cell have painful crises as well. Yes, actually, some people do say that. Yes, they do say they feel more tired than normal people, and they do have pain. Yeah, I do. Although research, we haven't had any research that back that up. But if you speak to patients themselves, well, to people themselves that have the trait, they do say that they have pain.
Okay. Okay. Thanks for telling us. Thank you, Sister Shakira. Thank you. Okay, so I think that's it. I don't have anything else to say, and I believe there is no question from our viewers. Thank you so much, sis. Thank
You're
you
welcome.
very much.
Thanks everyone for joining us, and it's my pleasure, because that's one of my I really love the specialty, and I enjoy talking about it. So anytime you have questions, just maybe get in contact with Rukky, my colleague here. We used to work together at Royal London Hospital, and she's a brilliant nurse. So yeah, I'm sure she will help you.
Thank you. Even though I worked with you when I was a newly qualified, I was a baby nurse then.
I know.
I
feel so old.
Yes. Thank you so much. And she said, yes, she knows someone with full sickle cell at the age of 55, and she's still living.
Yes,
sickle cell is
only this person is 80 something years old. So
you see, it's not a death sentence. You can live a normal life with sickle cell. Yes. Thank you so much. I would leave you to go in case I still have questions coming in from viewers, and I believe I'll be able to answer them. Yeah. Thank you so much, sis.
No
God
problem.
bless you. Have a wonderful evening.
God bless
Bye.
you. Thank you for joining us. Bye-bye.
Bye.
Bye.
Okay, hello guys. Thank you so much, my wonderful people. Thank you for watching. Thank you for your questions. Thank you all the time. Thank you for the future as well. Any questions? Can we talk? Is anyone interested in calling in? Shakira or your call? Can I call you in to talk a little bit? Tell us your experience about sickle cell. You said you have 3 sickle cell patients in your family. Are you happy to talk to us about it? If yes, can you please join the video? Or we've got a lot of people watching right now. I don't mind if anyone is happy to come online and talk to us, to share a bit of information, tell us your experience. Not now, okay? Shakira said she's not available to talk right now, but if anyone else is available, it's 2 minutes. I don't mind, we can wait. Sickle cell is not a death sentence, people, and I'll say it again and again. There are a lot of diseases that people have that are more deadly and dangerous than sickle cell. You're welcome, sis. Like cystic fibrosis that I mentioned earlier is infection of the chest, of the lungs. Thank you, sis Donatella. Thank you. Cystic fibrosis is the infection of the lungs. The life expectancy for patients with sickle cell is small. I think is maybe age 20 or 21. You can imagine, and we don't have that in sickle cell. And sickle cell disease, if it's well managed, you do your part and then you leave the rest for God to handle. I believe the patient will be fine. I've got people that has sickle cell. I've got lots of kids that I know that has sickle cell, like my patients, and all things being equal, they've been fine, they've been living a normal life. Is you know, it hasn't reduced or affected the way they live, or it's not actually affected their lives in any way. It's just about how well you look after your child or yourself if you're the patient yourself. And back in Nigeria, it's so bad because of the stigma. I lost a friend when we finished secondary school. She didn't die when we were in secondary school. She died after secondary school. You know, she died of sickle cell disease, and other people as well that I think I've had a few people that died. And it's not actually because of the disease itself. They did die because of sickle cell itself, but they probably died because of one or two complications associated with sickle cell. For example, pneumonia, the chest infection can kill. You know, which is why they do give the patient this, which is why they give sickle cell patients antibiotics to stop them from having pneumonia. Because even if a child does not have sickle cell, a normal well child without sickle cell can die from pneumonia, can die from chest infection. And it's very common in Nigeria. People, you know, people have lots of what is it called, air conditions in their house. Air conditioner, AC, is not good for the health. And I know people that has children in the household and they have lots of air conditioner, or they put it on to the highest setting just because the house is hot. It's not good. AC can feel good to the body. You can feel like, oh, my body is cool, but it's actually not good. It can cause pneumonia. AC, air conditioner in Nigeria, is not good. Please, let's try and reduce the way we on AC in our house. If you've got children in the house, can you please always try to minimize the setting of the air conditioner, or even fan? Fan as well is not good. You know, because if it goes straight into the ribs, into the chest. Okay, Shakira says she's free now. I'm going to call her in to come and talk to us about sickle cell. She said she has few people that she knows that lives with sickle cell disease. I'm going to call her now to come online and talk to us. I've started calling you, Sister Shakira. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
Thank you so much, sis.
Hello, everyone. I'm not a specialist of sickle cell, but I'll be talking from experience. Right?
Okay.
Yes.
And she's a nurse as well. She's a nurse, a UK trained nurse as well. So can you carry on? So she's going to talk from a personal experience point, yes, and as well has been a nurse. So she's talking from two aspects now. So okay, we are listening.
I'll start from personal experience.
You can't see your face properly. We can only see your glasses.
Okay, can you see me now? Okay.
It's a little bit better.
Switch on the light for me. Okay, talking from experience, I have 3 siblings with sickle cell. It's a very challenging disease, very challenging. In Nigeria, where we came from or come from, the Nongpe, stigmatization is really killing us, right? Okay, I've got 3 siblings. I've got 1 niece with sickle cell as well. But coming from the family with sickle cell, even my brother that doesn't have the sickle cell, just have the trait of sickle cell, and has 3 siblings having sickle cell, is still denying the fact that the daughter has got sickle cell. So it's like, Shadengbo, can my daughter have sickle cell? So I was like, what are you talking about? Why are you in denial? You get it?
Yes. Even for the fact that he has 3 siblings with sickle cell, yes, and he's still living in denial.
He's still living in denial, yes. My father has got sickle cell with a C trait, with a C carrier. My mother has got sickle cell trait. So that is where the sickle cell has come from our both parents of SS carrier. So, but I was just lucky to be an AS. Yes, but it's a very, very challenging disease. I remember when we were growing up, if one of them is going to have crisis, the other two, they'll take it. Same time.
At the same time.
Same time. Then we don't understand it. My parents would just be, running all over the place.
And self-medication as well.
Of course, self-medication, agbo, everything. Be saying they'll be called, they have names. That's what they call them. But alhamdulillah, two of them, they got married and having children, but unfortunately I lost my sister. But she got married as well, but unfortunately she passed away. Yes. Then from my husband's side as well, we've got a sickle cell as well, full one. She lives in UK. She's a big woman now, much, much older than I am. She's in her 50s. So if sickle cell is well looked after, then the carrier lives long. But unfortunately in Nigeria, with our, should I say our, what's it called?
Is it mentality or health system?
Okay, our mentality, our health system as well. If I come up on my mini sickle cell, you get it?
Yes.
Hiding everything. Don't speak out. You don't ask questions. Because when my brother told me, I was like, why are you talking as if you're not educated? Okay, you're not educated. It's in our family. Your wife has got sickle cell. So what are you talking about? So he said, you're running.
So okay. Sorry, sis. He's a carrier, and his wife
is a carrier as well.
So it should expect such to happen.
Yeah, but when they are in denial, they will still say run. Say. So he went for another blood test. They confirmed it. He did 3 blood tests.
Wow.
Yes, he did.
If this was coming from someone, sorry to cut you, sis. If this was coming from someone that does not have the sickle cell trait or disease in his family, fair enough. And if it was coming from someone whose wife does not have the disease, then fair enough. But for the fact that he's had that experience from his family background, and his wife has it, so he should have a lot of knowledge about it. And he should expect such.
Yes. But luckily for him, he's got 5 children. One of them is the carrier. So alhamdulillah for that.
No, is the carrier or as the
No, sorry, full one. Not a carrier. Full blown sickle cell. I am a carrier as well. All my children are carrier. So you can imagine if my husband had been AS, I don't know what would have happened. But all my kids they've got the S from me.
They've all got that S from you.
S from me, yes, because my husband is AA. So I believe if we are more knowledgeable, as our sister Corinne, as she said, we need knowledge. We should stop being in denial. Stigmatization, we should stop it.
And even I know a family that lives there in the UK as well. Even though, I would say there are people that has knowledge about what sickle cell is, or they have someone that works in the medical profession in the family. They still
in
I don't know how to put it. No, well, not denial, sort of, but that stigmatization. I don't want people to know my child has sickle cell. It's still there. It's still there. And I don't blame them. I don't blame the couple. It's because of our background.
Nigeria, I understand.
They are Nigerian couple, of course.
I understand where they are coming from.
They are Nigerian couple.
Stigmatization from where we are coming from, isn't it? If I come out, stuff like that.
Exactly.
We need to stop it. We need to stop it. Yes, we need to stop it. They do come to hospital. They do come to hospital. I'm not trained for sickle cell. I'm a general nurse, adult nursing. So when they come, I know every hour, bang on, you have to give them their painkiller. But some of the staff nurses are just nasty. I will be fair. Oh, they're disturbing me. They're asking for too much. They're doing this, they're doing that. But for
the fact that you know what it is, because you know what it is, you will look after them.
Yes, They are truly in pain. They're not making it up. I am a carrier as well. During winter or when it's rained, I know. I still feel it. I feel the pain in my legs. So I can imagine the full carrier, what they will be going through. And my sister-in-law, when she starts as well, you don't want to see her in bad shape. The pain is a killer. And anyway, let's forget about sickle cell pain. Pain itself can kill.
Oh yeah.
Yes, if we have women in the room that
pain can be unbearable.
Yes, labor pain can. We know. Okay, let's say we don't know other pain. Labor pain, we know it can. It's some people scream, some people roar like lion during labor pain. So we should understand when they are in crisis. We should respect that.
Yes.
So I think I've said what I want to say.
I was gonna ask you a question, but then I forgot.
Okay.
So thank you, sis. Thanks for talking to us about your experience. But what advice do you have for us?
Okay, advice is before a man and a woman or a boyfriend and girlfriend, before they get into serious, very serious,
before they go deep,
before they go deep into their relationships, please check for your genotype. Check to see if you're a carrier, because it almost happened to me. Yes, the person I was going to settle with was a carrier, and I knew
as well as
yes.
you.
So I was like, but only bawashe. But luckily for me, he was like, he's in your family. My brother's son, he was saying his nephew is a carrier. So we both know. So it's just like we're trying to be wicked to any children we're trying to have. And luckily, because of love. And when they say love is blind, wallahi, love is blind. You can do anything because of love. But alhamdulillah, we went separate ways, and
here you are.
Mr. Yekon just came into the picture, and alhamdulillah, and yes. So my advice is, before you go into deep relationship, check for your genotype and be sure, don't lie to yourselves, all in the name of love, because we know our health in Nigeria is not like this country. When the trouble comes, we cannot stand it. Carry trouble when the crisis comes. But here we know the health system here helps a lot. But where we're coming from in Nigeria, we all know. We know. But even
Nigeria, regardless of whether you have the money or
not. You will just be hearing in-laws pressure. Go and marry another wife. You know, we've seen it in movies. What we've seen in movies is really happening in real life. Yes. So let us just be.
Let me just chip in something. You mentioned something about love. Yes, love is blind. Yes, we advise people to check their genotype before they go into relationship, or maybe you've been in the relationship and then you realize, okay, let's check our genotype, and then it might be okay. Yes, for example, a case scenario. Let me give us a case scenario. I know a couple. They started a relationship. They started going out. They did the introduction, like meeting, both families meeting each other. People, can you please specify if you're listening and if you're still watching, please? Is money draining in Africa with people? Yes. Money is not draining in Africa. It's not raining, regardless of whether they're rich or not. Sickle cell is still sickle cell. So can you please let us know if you're watching and you're listening and you can hear us properly? I just want to give a case scenario. So this couple did their introduction, both families meeting each other. Then, so later on at some point, someone, I don't know, the bride's parents realized that both the bride, the lady and the guy have got sickle cell traits. And then they were like, you can't get married to each other. You have to stop the relationship. You have to call it quits. we can't accept you getting married. You know, the whole scenario, the whole confusion went on for such a long time. And then at the long run, the lady got pregnant. The lady got pregnant. I have this couple, they have a child which just came to the, not the sickle cell, well, let me finish and then you see where I'm coming from. So they got married, they got pregnant, and then before they got married, they got pregnant. So there was nothing the family could do. They had to leave them to get married. So they got married, they had their first child. The first child was fine without the traits. They had the second child as well. And I think maybe, oh yeah, they had 2 kids. The first one was fine, and then the second one has the disease. The second has the disease. The disease. The disease.
Okay.
Yeah, the second child has the disease, but our own disease is, you know, you wouldn't even know she's got the disease at all. You wouldn't know. She's fine. She's a well child. There is no discoloration, no yellow, like what Sister Corinne said. She doesn't have jaundice. You wouldn't know that this child has got disease.
That means
the
child is well looked after.
The child, I believe so, is well looked after. You wouldn't know that she's got this disease at all, at all. She's never had, according to what I was told, because I had a long chat with the mom, because she ended up bringing another child to the hospital, but not the child with the disease.
Okay.
Another sibling. So we got on talking. I think the child had tonsillitis, and then they did the surgery and it got infected, so they had to bring him back to the hospital. So he was in the hospital for quite a while. So it's like, and then, you know, when you look after a patient, you come back, you know, when you have, let's say you've looked after this patient on a day shift or in a night shift, then you come back again to work the following day and the child is still there, we tend to continue. See, do you understand? We tend to continue the care. You can ask your colleagues, oh, I would like to continue looking after this patient. So I had the chance to talk to mom because I looked after them like on a daily basis, sort of. So just that child has sickle. I think they've got 5 kids now, and just one of the 5 kids has got the disease. The rest of them are fine. They haven't even got, I think it's just, one of them has the trait and one of them has the disease. And the other 3 are fine. They are not even carriers at all.
Wow.
And it was so difficult for them to carry on. Yes, they're so lucky. Having 5 kids with just one sickle cell patient, they're so lucky.
Wow.
It's not common. That kind of favor is not common at all. And even for the child that has the disease, is a well child. So they will classify that sickle cell patient as a normal child because she's fine. So she was not telling me her experience, what she went through from her parents, her families, her uncles and aunts about, you must not get married to this guy, you can't get married, you're both sickle cell carrier and all that. It's actually affected both of them psychologically, emotionally and all that, you know. And I kind of see where the parents are coming from, but then you can't impose what you want on the child, because later on in life, if that I'll say the grandchild has sickle cell crisis and all that, it's both of them that will deal with it, not you. Do you? I don't know. Do you understand what I'm saying?
Yes.
All you can do is just to advise them and pray for them, and then you leave the rest for them and to God. You know, when she was telling me about it, I really felt for her, and I was so grateful for her and so happy for her. I think the network is not good. Can you hear me, sis? Can you hear me, sis? You know, I felt so happy for her. For the one of them just has the disease, and at the end of the day, that child is a well child. You know, let me call Shakira back. So, you know, as parents, it's our job, it's our responsibility to advise our children on what to do. but we shouldn't impose what we want on them. And I think it's because of stigma. But then stigmatization will never go away. Even if we're not talking about sickle cell, once there is stigmatization in anything, it goes on and on and on. Okay, she says she has to go now. That's fine. Thank you so much for joining. And I think we might actually call it a day now. I don't know if we've got any more questions or if there is any other person that is willing to come on the video to talk to us about their experience as well. And, you know, it's been a wonderful topic to talk about. Sickle cell is a wide topic to talk about. We can't finish it at once. I don't mind coming again, you know, to talk more and more and more about it. And thank you. Well, yes, thank you so much. Thank you, everyone. Thank you for the words of encouragement. Thank you for, you know, for giving me your time. I didn't know this is gonna come out like this. I just thought I'll just, you know, first few topics about, no, actually, my initial topic, which was sepsis, was just like a one-off topic for me to post for people to read about. Then later on, I got loads of comments from people, you know, advising me to do it every now and then. Sickle cell is money draining. Yes, it's money draining. It takes a lot of money back in Nigeria. Yes, so I started off with sepsis. I was like, okay, and the reason is, I'm gonna be honest with you guys, I was nominated by my ward manager at work to be the link nurse to sepsis at work, which means I'm just going to be talking about sepsis. If there is any information from the trust, from the hospital as a whole, then I have to take the information and bring it to my colleague on my ward. Then we talk about it or do any learning, or maybe I can do a learning pack on it. So I was like, okay, then fair enough. I'll do a presentation, a PowerPoint presentation about sepsis. So that fateful Saturday, I decided to post it on my Instagram page for people to read about it. So I got lots of comments, positive comments. People were so, you know, glad that I was able to do that. So people advised me to do it from time to time, maybe make it a point of duty for me to talk about it. And actually, the first person that advised me was a friend of mine. She joined us and she told us then that she lost her son to sepsis. So sorry for your losses, and I pray the good Lord will give you another child, twins, triplets, you know, that will be with you for the rest of your life. Will be. So she advised me to continue doing this in order to give people awareness about what sepsis is. Then I decided to do the live video. I did that myself. It went well, even though I was a bit over the edge. My first time of talking on a live video, you know, and I know people are sitting down watching me. But then I think your girl did a little bit okay. And yeah, that went well. So I was like, okay, then fine, fair enough. Let's do this from time to time. Then my second topic, which was, remind me guys, we treated that 2 weeks ago, appendicitis, sorry. We spoke about appendicitis, and I got my doctor from Nigeria. She joined us, our guest speaker. She spoke to us about what it is. So I posted the slide, and then a week after, we had the live video. And then I was like, okay, then let's go out again and look for another disease that is common in children. Then I decided to do sickle cell in children. Well, sickle cell in general. And which is why we're here today. This is my third live video talking about health conditions. So I've decided to name this program, this talk is now called Health Talk with Rukky. And any live video we do here on Instagram, I post it on my YouTube page for people, you know, that are not following me on Instagram, because my Instagram page is actually a private account. So if people would like to watch it, they have access to it on my YouTube page. So I'm going to post it there as well. I'm so sorry if you can hear but noise at the background. It's my children, you know, playing tantrums together. So, which is why we're here today. This is my third live video, and I've prepared another presentation on my next topic, which is tonsillitis. We'll be talking about tonsillitis. In Nigeria, they call it belu belu, you know, the pain at the back of the throat is my next topic. tonsillitis, and tonsillectomy is the surgery. Tonsillectomy is the surgery that is being performed on kids that has tonsillitis. I've prepared that. I'm going to paste it on my page maybe later on today or tomorrow to give people the chance to read about it, have a little bit of information about it, and then I can come back and talk about it. And I can actually call someone else to come in and talk to us about what tonsillitis is, the treatment, and what to look out for. So this is actually the reason, the rationale behind this Health Talk with Rukky. And it's been going, yes, tonsillectomy is the removal of tonsils. Tonsillitis is the pain, is the inflammation of the tonsils. Tonsils are sorry, I've lost my words. The two, anyway, we'll talk about it when it's time. Tonsils are the two, I've forgotten the actual word to call it. There is a name for it, but the two, I'll call it, is like, I've lost my words. Tonsils are the back of our throats. So tonsillitis is the infection or inflammation of the tonsils. So that's going to be our next topic. I've got it prepared, it's ready. I'm just going to post it. So I might get someone to come and talk to us about it next week. This is the reason why we're doing this, to give ourselves awareness about what certain conditions and illnesses are. Thank you. The two droppings behind the truth. Thank you. I lost my words. Thank you, sis. So, if you've got any questions, let me know. Thank you so much, everyone, for joining. Thank you for watching. I really do appreciate it. I'm going to call it a day now. I've taken a lot of your time. We started this program at 5:05, and this is 6:41. We've been here now for nearly 1 hour 40 minutes, 1 hour 35 minutes precisely. Thank you so much, everyone. Thank you for watching. I'm so sorry, and I think I'm getting a little bit better. It's our third live video. I'll get better as we go on. It's still Health Talk with Rukky. Please tell people about this program. I'm more than happy to learn from everyone. We're all here to learn from each other. No one knows it all. I don't know it. I've actually learned a lot from this sickle cell discussion we've had tonight. Thank you so much, guys. Any questions before we go? Any questions? Okay, I don't think there is any more questions. Thank you so much, everyone. Thanks for watching. I appreciate you. I'm going to post this on my page for everyone to watch. And any questions, please let me know. It's still me. It's still your girl, Rukky. And I hope I'll get better as we go every day. Thank you so much. Have a wonderful evening and have a good weekend ahead. Bye, guys. Thank you.